be covering the dermatological treatments for hirsutism. So I'm Dr. Aakriti Chawla. I'm practicing in Noida. So ma'am has already covered about hirsutism. That's the excessive hair growth in a male pattern distribution, females. So you can clinically evaluate if there is any sort of hormone disbalance that is underlying that has to be addressed before you can go for hair removal treatments like laser or electrolysis or anything else. Because what happens is if the underlying hormone disbalance, like in case of PCOS or whatever the other reason may be, if that is not addressed, even if you're getting laser done, you will see some results. There will be some reduction in the hair, but it will come back. So the underlying hormone laser treatment along with the treatment for the hormones. It's not like you have to wait that okay, first I will get all the hormones corrected and then I will plan laser. It is not like that, obviously, because hirsutism has a lot of psychological impact because as females you have thick male-like growth. So you can start the treatment and start the laser along with it. That is usually the best form of treatment. But I'll come to the other options as well. So Feynman Gallwey scoring system, this is more useful to assess the improvement in the growth, not for diagnosis, as ma'am had already explained. This is more when you want to address that, okay, you had this much growth to start with, and now after treatment or after laser, this is how much your growth is. The score is decreasing. So it gives a feel good factor to the patient as well that, okay, yes, I am seeing improvement. Because a lot of times, especially in dermatology and cosmetology, we see this thing where, you're seeing yourself on a daily basis. So when you see a gradual reduction, you're not able to appreciate it. So the score helps assess that as well. So coming to the topical treatments, this is a very common cream known as eflornithine cream. Eflora Kinase, we get it in India. So what this does is it slows down the facial hair growth. This is not a permanent solution. This is temporary. When you use this cream, you will see results within 4 to 5 weeks. The problem with this is that when you stop using this, the growth that it has kept at bay, that will come back in about 8 weeks, right? So this basically, how this works, it inhibits ornithine decarboxylase. Now this is necessary for synthesis of various polyamines and other molecules that are required for cellular growth. So since it inhibits cellular growth, it inhibits the growth of hair because you're going to apply it only in the area where you have hair. And it, like I said, it provides temporary relief. It can cause skin irritations and allergic reactions. There's no as such contraindication to it. The pregnancy category for eflornithine is category C. So if somebody really needs to use it, they can, right? But this is not something that is, recommended on a daily basis, especially to young females who have thick male-like growth, right? So it's best for mild cases or as adjunct to other treatments if, the patient does not have a lot of growth, like they have, patches or maybe few hairs. Then this is of benefit. Otherwise, laser will always be the best treatment as of now. So coming to laser and light-based therapy, it is basically going to target the hair follicle and reduce the regrowth. And it has best results when your skin does not have tanning. Light skin here does not mean that, skin like in foreigners, but light skin as in when your skin does not have tanning or it is not really darkly pigmented. Because if that happens, then it interferes with the lasers. I'll shortly explain why. And laser works best on dark hair. If somebody is in the older age group and they have hirsutism, which has come back, or a post-menopause, it has increased, or they did not take treatment previously, they have not taken laser previously, they were just shaving or waxing. So in those individuals, it becomes a little difficult when they have white hairs because laser will not work on white hairs. Again, I will explain when I explain the mechanism. So there are various types of lasers and it will require multiple sessions. So it can be a little costly, but these days lasers for hair reduction are very easily available and they are quite affordable as opposed to how much they used to be maybe say 7-8 years back. So now types of laser for hair reduction, we have different lasers. Now these lasers, how they are classified, the source of the laser, that is the basic physics, that a source of the laser which will generate that light. So that is different. Then there are different lasers depending on the mechanism with which they are acting. So based on the source of laser, we have ruby lasers, alexandrite lasers, Nd:YAG lasers, and intense pulse light lasers that use the natural light for giving that desired action. So now this can turn a little confusing. So I'll make it simple. Now, how does the laser work? The laser works on the principle of chromophores. All lasers, for whatever reason that you're using a dermatological laser, they work on the basis of chromophores. Now, what are chromophores? These are basically molecules that are present in the skin. It can be water, it can be melanin, it can be keratinocytes, or it can be anything that has color. The most common one being melanin. Now, this laser that is used for laser hair reduction, what this does is that it goes to the base, the root follicle of the hair, and it releases heat energy. Now, that heat energy will destroy the hair and it will destroy the surrounding area as well. Now, why do we want that? Because in the hair there is something known as a bulge that has stem cells that cause the hair growth. So we want to destroy that area as well. That is why laser is so effective. Because not only will it get rid of the hair, it will also get rid of the potential of the hair to grow. Right? But this is a slow process. It does not happen in one go. That is why you need repeated sessions. And it takes a while to totally, get rid of that potential. One thing I would like to make clear here is that a lot of people use this as synonyms, but that it's not. It is never laser hair removal. It is laser hair reduction. Why? Because it's a gradual process. You will need multiple sessions. If say you have 100 hairs, it will get reduced to say 20 over the course of 6 to 8 sessions. That is what we usually recommend. कि आप 6 से 8 सेशन पहले कराइए, रिजल्ट जितना आएगा उसके आगे we'll decide whether you need more sessions or not. 1 month के गैप पे यूजली ये होते हैं एंड ग्रेजुअली यू विल सी कि जो थिक हेयर है वो फाइन होने लग रहा है. अगर 100 हेयर्स थे तो धीरे धीरे 80, 60, 20 ऐसे धीरे 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 कम होंगे. एंड जो थिक कोर्स हेयर आ रहा है वो धीरे धीरे फाइन होता चला जाता है. ऐसा नहीं होता है कि पूरा सब सपाट सारे बाल चले गए हैं एंड दे नॉट ग्रोइंग ओनली. यस, द हेयर विल ग्रो लेस. Some hairs will not grow at all. Some hairs will still remain, retain that potential to grow. Now, something that happens later on, like if the hormone disbalance recurs, especially in case of PCOS females or in females, when they reach menopause, because of hormone disbalance, they see a surge in the growth. So it's not like that laser failed. It's just that when the reason for that hair growth is back, the effect the laser had will not retain, right? So this is something that needs to be balanced and it can get a little confusing, but जब तक hormone balance है तब तक लेजर का इफेक्ट रहेगा, लेजर अपना रिजल्ट दिखाएगा. लेकिन अगर हार्मोन डिसबैलेंस वापस आ जाता है तो बहुत बार लेजर का इफेक्ट नहीं रहता है. It is not necessary that it happens in everybody, but it can happen. So this diagram is basically showing how laser works. Like I explained, abhi types of laser mein there's something known as intense pulse light, and then there are the normal lasers that we use for hair. It's going to go and it's going to destroy the hair follicle. Right. So how do we usually do lasers? We first shave the hair. No, shaving does not increase hair growth. ऐसा होता तो सारे गंजे कर लेते. But we first shave the hair. Why? Because हमें surface पे hair नहीं चाहिए, हमें root को target करना है. Cooling gel लगाते हैं and then we give the laser. So that is going to destroy the root. Now, what all lasers are there in the market? The most commonly used one is a diode laser. It's usually a combination laser of different wavelengths that I have previously mentioned. Why are we using combination lasers? Because nobody has uniform growth. कुछ बाल थिक होते हैं, कुछ बाल पतले होते हैं, कुछ बाल बहुत ज्यादा पिगमेंटेड होते हैं, कुछ टॉप लेयर में होते हैं, कुछ डीप होते हैं. So different wavelengths help us target everything. And the laser, the diode laser that is there in the market, it is relatively painless because it is done in a continuous mode. It is not done point by point on the hair follicle. It is done in a continuous mode, so it is relatively comfortable even whether it's on the face or any other body part. The other laser that was used more commonly, say 7 to 8, 10 years back, is ND-ag laser. Now, this is a single wavelength laser, and it is quite effective on the Indian skin, especially a lot of females come with fine hair. So it is very effective in that, but it works point by point on each follicle, like the way the laser is done. So this tends to be a little painful for some people. Now, there's the other thing that can be done for hair is electrolysis. This is not commonly done these days because it can lead to a lot of scarring. And how this is done, a fine needle is penetrated to the root of the hair. The problem is that a lot of times the hair is in a slanting position, or the way the hair is coming out might not be how the hair is inside the skin. It could be slanting, it could be oblique, and you might not be able to reach in one go to the root of the hair. So it might not be effective. Nowadays, this is mostly reserved for people who have white hair. Since laser does not work on white hair, this is used for white hair now. This basically uses an electrocautery machine or that uses electrofrequency to destroy or coagulate the hair root. This is permanent, that hair that is destroyed, if done properly, it's not going to come back. But like I said, sometimes the hair looks to be in one direction but is in some other direction. So the result might not be adequate and you might need to get it done repeatedly and it can cause scarring. So this is like the last option. And of course, the adjunct treatments and lifestyle modifications, these need to be done because obviously if there is hirsutism, there is some underlying hormone disbalance and that needs to be addressed with diet and exercise, weight management, right? And a lot of people these days, they recommend spearmint tea. So to summarize, hirsutism is often linked to androgen excess. Treatment includes topical options, laser therapy, medications. Lifestyle modifications can improve treatment efficacy. Consultation with the dermatologist is essential. Why I'm saying this is because a lot of times these days you have a lot of MBBS doctors or dentists or even non-medicals doing laser. Especially a lot of high-end parlors and salons, you have lasers available for hair reduction. The problem with this is that even though the way the laser is done is not a huge learning curve, the power at which the laser is given, that has to be specific to your skin type, your hair type, and the sort of growth you have, right? So if that is not given, one, you will not see results. Second, you'll see side effects like redness and itching, and in some rare cases, they also see paradoxical hair growth, in which you will see instead of the hair reducing, you'll see an increase in the fine hair growth, right? So it should always be done under a dermatologist's guidance because that ensures you results and less side effects. That's about it. I am Dr. Aakriti Chawla, practicing in my clinic in Noida, Reneha Skin Clinic. Thank you.
Thank you so much, Akriti, and thank you, Renu ma'am. I would like our experts to please give their opinion. Dr. Hamid Khurana ma'am.
Let me start by saying congratulations to both the speakers for an excellent discussion. Very lucid, very clear, very simple way of explaining this distressing condition. Patients come very upset with hirsutism. A special thanks to Dr. Aakriti. We always have to work hand in hand with our dermatologist colleagues. We cannot work without them. We agree, Dr. Aakriti. We need your supervision and help in managing hirsutism cases. Coming to Dr. Renu's lecture, very beautifully done, ma'am. Very easily explained, especially the part about the laboratory investigations. That was very, very clear, the list about how we need to go and when we need to react. I want to emphasize one thing that since the commonest cause of hirsutism is PCOD, when we see PCOD patients and we write out these investigations, we see that the DHEAS is very high. So you've got to remember that the DHEAS is going to be high in 20 to 30% cases of PCO patients. It normally is a marker for adrenal disease, but even PCO patients, 20 to 30% will have a DHEAS above normal range, but only if it is more than 700 microgram per DL, as highlighted in the talk, should you then refer to an endocrinologist or panic or think of adrenal causes. Also, something which we were drilled in our PG days, that yes, it's PCO and testosterone, but any testosterone level more than 200 nanogram per DL. You're not going to see this very often, but you should not miss this case. It is something which is pointing towards an ovarian or an adrenal malignancy. This should alert you immediately. So for ovarian, you will do ultrasound, and for adrenal, you would do an MRI. My last point of discussion is about counseling these patients. They are very distressed considering the age of social media. They're undergoing huge mental trauma, but we as gynecologists need to tell them to be patient. Very important to tell them that any kind of treatment, we've explored a lot of treatments right now, is going to take time. You must tell them to be patient for at least 6 months. And especially in drugs like spironolactone, don't be in a hurry because patient is unhappy, patient wants quick results. You cannot get quick results. Like even Dr. Aakriti said, patience, they need multiple sessions. And also tell the patient that if they want to do something for themselves, weight loss has been known to dramatically help in treating this condition.
Yes.
Thank you for this opportunity of being here.
Thank you so much,
Thank you,
ma'am.
ma'am.
Dr. Charanjit Kaur.
Hi everyone, good afternoon. Thank you for having me here. So like Harmeet said, weight loss is an extremely important way to reduce your adrenals, your plasma androgen levels. And both of these things, obesity and hirsutism, they are both so important to be tackled almost together. So there are two things. Very good lectures. There's not hardly anything much to add, but there's only a new thing which is coming now in the markets, which is a combination of a beta aminobutyric acid and something called abscisic acid. So this is a combination which has shown good results in reducing the testosterone levels by about 33%. And this really works very well when a person is facing the wall, trying their best to do all their exercise and lifestyle measures and still not really getting the results. Then this combination has been shown that if you take it, at least by what the records say, and this is a report from John Hopkins, it's not an Indian study.